This patient is an 88-year-old black woman with an ectropion that's very severe. She has exposure of her conjunctiva and chronic drainage from having her eyelid rolled out so extensively. The patient and I have spoken about her situation, and she said it's intolerable. Even though she's an aged woman, she's an excellent candidate for a remediative reconstructive surgery. This procedure was performed in about an hour as an outpatient surgery, and you can see her in her other views side by side that's solved the problem. Her eyelid is in excellent position. It coapts and abuts the eye properly. The corner of the eye is properly reconstructed. The excess lid that's so loose, as well as the retractor muscles that have become disinserted with her age, are now reinserted in the right position surgically. I know she's very happy. The front view and side views definitely show the restoration of her normal eyelid shape, and she has a long-term prognosis for an excellent outcome. She's very happy, as you can see by her happy smile. She's a very darling lady.